We know more about extending lifespan in model organisms than ever before. mTOR inhibition, senolytic interventions, NAD+ restoration. But if you walk into a standard clinic with chronic fatigue and normal labs, you'll get told to sleep more and maybe try a multivitamin.
And that gap specifically between what the science shows is possible and what the system can actually deliver right now today is where today's guest has pretty much built her career.
She's a Stanford-trained physician who left academic medicine to build the infrastructure that makes doctor-supervised longevity care actually scalable.
And she's writing some of the sharpest reality checks in longevity right now. Why your mitochondria might be zombie batteries, even when your blood work looks perfect, and why most people are fueling their system before cleaning it.
We'll talk about why the biggest bottleneck in longevity isn't discovery, it's delivery. And also how healthcare has to restructure when patients want continuous optimization, not episodic treatment.
And then we'll also get tactical, like what actually moves the needle when you're already doing the basics. How to filter signal from noise when everyone is selling peptides and protocols, and how to think about biological systems when performance, ambition, and also long-term health collide.
Dr. Hilary Lin is a board-certified internist who trained at Stanford and worked at Columbia before making a deliberate exit from academic medicine.
And then she went on to founding Curio, which scaled mental health navigation across multiple US states. Then also co-founded CareCo, an AI-enabled clinical infrastructure platform that now powers wellness brands, longevity clinics, and physician creators operating across state lines. So, without further ado, welcome on the show, Hilary.
Thank you so much for having me. I'm so excited to be here with you.
Amazing. Let's maybe start with a little bit of a background and your origin story. So, as we already mentioned, you trained in pretty much some of the most rigorous medical environments in the US. So Stanford, Columbia, and all of that. So can you share a little bit about the story behind this, just for our viewers?
Yeah, I always joke that I spent the first part of my career doing everything that your parents might be happy with. And then I spent the next sector ongoing, making my entire family very confused. So it was a great honor and a wonderful experience to train in a top tier institution like Stanford and later at Columbia too. These are amazing academic centers, but even at the best institutions in the world, but traditional medicine is still practicing sick care medicine. And that really burned me out and wore me out over the years. And I saw that in my mentors too. Most doctors, they enter the field, they want to help people prevent disease and live a long, healthy life. But the system, particularly what I call the insurance-gated system, restricts our activities to only caring for people at the very edge of their health and sickness, and basically when it's almost too late to make a significant difference. So I left originally the traditional path to enter mental health because at the time especially, mental health was heavily ignored. And I thought that that was a very fundamental piece of healthcare that we all need to take care of. And moving on to now, I've entered this field of building infrastructure for longevity, because longevity, as we all believe in, is the key to prevention, personalized medical care that works very, very early. And also because we see a lot of people building businesses, but I think the infrastructure isn't quite there to help scale. It's a very big problem because, you know, in the US and even in other systems that work somewhat differently, the payment system doesn't enable the scalability of these consumer first services. And so we are building a way that is outside the traditional system, but allows a clinician or service provider to have a lot of success and scalability.
So you're essentially decentralizing the access to things by removing the gatekeepers of insurance-based system. Did I understand that correctly?
Yeah, it's absolutely right. I am a big believer in decentralization of healthcare, bringing it closer to the end user, the consumer, or the patient, whatever you'd like to call. And I think that is necessary as we're becoming more and more personalized in our approach. As people become more educated about their own health and they have more agency, it's important to give them the tools directly rather than making them jump through hoops by seeing one practitioner, then another, and then trying to figure out what their insurance will actually pay for.
Interesting. And Now, if someone were to play devil's advocate, for example, they would say that people may not be able to make these choices and we need to protect them from too free access to certain things that they may not understand properly. Hence why the traditional model of the gatekeeper being the doctor or insurance system was put in place to protect people from certain outcomes. How would you respond to that?
Yeah, I think we are all growing up as a society at large. So this revolution in longevity and personalized medicine is very analogous to the revolution in AI and how AI in general is enabling the average person to get access to so much more knowledge than they could before. So in a similar fashion, people who are moving with AI, learning with AI, they're going to understand their health better. Today, I would still say the average person plus AI still doesn't quite understand as much as a doctor does, and especially not a doctor with AI. That's it's a superpower in some ways, but that's going to change very quickly. It's just a matter of understanding how to use the tools that AI enables. And so people are becoming more up to date than their clinicians in a lot of cases, especially in today's model. Clinicians are so incredibly busy. If you look at a primary care, clinic, they see perhaps 1,000 patients on their panel, which is a ridiculous number. And they're just a cog in a wheel that's trying to churn out as much revenue as possible for whoever they're working for. So it's very hard for a clinician in that setting to be very on the edge in terms of thinking or the science that's coming out. Like the amount of scientific knowledge that's being created through studies and outcomes are, and not to even mention the data that's being generated by not just studies, but wearables and more real world data, that is impossible to keep up to date with in the traditional sense. And so we are seeing real time a very, very big evolution of how healthcare is delivered or understood or consumed by the user. Guardrails, as you alluded to, are extremely important still. I don't think we're quite ready to just allow everyone to do everything that they imagine and want to do, because there's still a bit of a gap. I think
biohackers would love that, though.
Yeah. I think maybe we can get there. I don't think it's impossible. I just think at this very moment in time, the average person has not quite yet figured out what their own safety guardrails should be, perhaps. And so I think we're figuring it out. And I don't think it's impossible to see a world that's like that one day. And I think it's a matter of asking informed consent. So the user, the patient, they need to really be informed. Like a lot of people, they jump to conclusions. They're like, I heard testosterone really changed the life of this guy. And I think it's right for me. I want access to it. And that's the simplified thought, but they need to fully understand what that means. Like, what are all the options and, what are the consequences? And a lot of times the average person doesn't have maybe the patience or the experience to understand that fully. I think in the future, maybe that can be wrapped up into some sort of AI first healthcare system, let's just say, and it could work where there's not a clinician in the loop even. So I don't think it's impossible.
Yeah, I think I certainly agree, and I would hope to see that future one day. And we will definitely dive into those topics a bit later on as well when we talk about, for example, peptides and other topics. But for now, I want to take a step back as well and talk about your first startup, Curio, which focused on pretty much mental health navigation, because I found that to be also extremely interesting. I really want to understand a little bit more about your experience there. Like, for example, what did that specifically teach you about, like scale regulatory friction, and also, for example, the hidden bottlenecks in healthcare in general? That would be super interesting to me.
Yes, it was a wonderful experience and also a wonderful learning experience, because my whole team was so mission oriented. We really wanted to bring mental health to the general public. It was so unknown at the time. And our first focus was mental fitness. Can we teach people the skills to build emotional resilience before they become ill? And the very first lesson we learned is that it's hard to get people to pay for something when they are well and not in pain. And specifically for mental health, when someone is in pain, as you can imagine, a lot of times it makes them more incapacitated. So it's hard to get them to do some of these things like coaching and so forth. That being said, we also at a couple years into our life cycle, we started enabling psychedelic assisted therapy and coaching, which is a very powerful modality. And we saw in our nationwide clinic, we saw a lot of powerful changes. The main problem here was there was still a bit of a mismatch between the people who needed it most and accessibility, because it's not something that is covered by insurance and it's quite outside the traditional circle. And so you have to be pretty proactive to be able to access psychedelics, and you need also the funds. And even though we were priced at a very accessible standpoint, a lot of folks who need that level of mental health care have zero funds. And so there was a bit of a mismatch there. And finally, the not just regulatory, because we were operating completely with a completely legal substance, like we were working with ketamine, but also culturally, the way healthcare currently works is there's a lot of word of mouth, there's a lot of referrals, and a lot of traditional healthcare workers, including many mental health care workers at the time and even still, were not very knowledgeable about psychedelics, and so were a bit fearful about referrals to a type of service like this. And so I think those were all important lessons to understand about like how it could be hard, even with a very effective model, to scale and grow.
That's super interesting. Maybe back then, but also still now, what would you wish the traditional care model, or let's say the traditional system with regards to mental health, would understand about the alternatives you proposed? Or what would you want to maybe see things through a different lens? What would that be?
Yeah, I think the common theme here is that folks working in the healthcare system are by nature a bit more conservative in thinking and a little bit less open-minded to new ideas. And I understand where that comes from because we're a very litigation-forward society. So people get sued all the time for trying new things. If something happens that, they can sue you for, people can win a lot of money. And so you end up having a very conservative culture, and people are more willing to prescribe an SSRI for like 3 decades than they are to try a few sessions of psychedelic assisted therapy, even though we all probably could get to understanding that, the latter is far more effective and changes lives in a positive way, much more than being on decades of medication that's a bit of a Band-Aid. So that's a problem that I think is more cultural in nature, and I'm not sure that it's easily solvable, but I think this movement towards consumer first and giving patients more agency and autonomy is helpful because it's showing that we need to change this outlook and our approach towards medicine in general.
So interesting. But when you were saying that obviously the traditional healthcare system is very conservative because of litigation issues and stuff, but also maybe someone would say, yeah, because there are no studies or the evidence is not really clear for some of the alternatives. How would you respond to that? And why do you think there is this maybe potential lack of evidence, or at least not the same amount and type of studies that we do have for the more traditional things such as SSRIs?
Yeah. Well, one thing to remind folks is also we don't have a lot of evidence for a lot of things that are actually happening. Like the example of SSRIs for decades, we've never studied them for decades-long use for mental health. We are now starting to see effects of decades-long use that are negative. And that was just, it happened. It's basically inertia is a real trap when you're in medicine. If something is quote unquote working well enough, it's very tempting to just keep the refills on for the rest of a patient's life. And people don't really think about, maybe this wasn't a good idea. Maybe we need to revisit why a person and we're just talking about SSRIs, but there's so many medications I think about like this, like stimulants for ADHD, or even like we put people automatically and reflexively on certain therapies very quickly sometimes in medicine. Like if you have a TSH is a little bit off, it's very very tempting to just immediately put them on levothyroxine for just a small example. But this happens across many, many fields in medicine. And as long as it doesn't alert you that something is wrong because of a lab abnormality, then you'll just be on the same exact therapy without revisiting it for decades.
Yeah, that's a huge issue. I myself had mental health problems in the past. I had panic disorder developed actually in my time when I was studying at Berkeley, so other side of the bay, pretty much.
Yeah.
Which wasn't a particularly pleasing time, to be honest. But there was also the topic of SSRIs, and I was always like, "Nah, don't really want this. I want to have different approaches as well." And then also during this time, I did a lot of checkups, and then also one topic which all of the time came up again, also during my VO2 max testing, for example, was mitochondria and mitochondrial dysfunction, which at the time I also had, which is maybe even linked to mental health problems, who knows. But I saw that you recently wrote an article about mitophagy, so pretty much your body's ability to clear damaged mitochondria, which I found super interesting. And I think you call those zombie batteries, which I also talked about in the beginning. I mentioned this. So can you walk us through that concept and also explain what all of those, what all of this means, pretty much?
Yes. I am such a supporter of the work right now happening around mitochondrial health. And I know sometimes people are like so tired of it. It sounds like a hyped up term, like the mitochondria, but I don't think it is. Like, I think we truly are just starting to understand mitochondria and mitophagy and all the related processes and how incredibly important it is. So to zoom out just slightly, because I think people don't even fully understand mitochondria just as a general thing, is that it is what is at the crux of metabolism in our body. So when people think of metabolic health, they usually think of blood sugar, diabetes, maybe weight loss, something like that, like fat oxidation, maybe if they're more advanced. But at the very core of it, we're talking about energy and how we manage it in our body. And the mitochondria are in the cell, the very thing that is managing energy. And that's why at the end of the day, I wouldn't be shocked if in a few years we discover that mitochondria are truly at the core of every single illness that we can imagine, because it's just integral to every single cell's health. So the idea is our mitochondria is deeply responsible for how energy works in every single cell. It's not the only way, like the cell wouldn't necessarily 100% get their energy from there, but it is the most vital component. And so if something wrong happens with cellular energy, then things start breaking down. But like everything else in our body, we need cleanup. People might have heard of zombie cells, for example, or cellular senescence. People might have heard of something called autophagy, which is self-eating. Mitophagy, like you said, is just the self-eating or the recycling of old broken mitochondria. And if that's not occurring, then you end up with a bunch of broken engines, essentially, in your car, which is the cell. And so you don't want that. And you need to have healthy, clean, like very smooth engines going on in your cells for as long as possible. And that will help support your mental health, your physical health, your energy levels, like how you're feeling, and even your performance levels. People at the edge of performance, I'm sure we're going to talk about it, but this is why we do things like zone 2 training and VO2 max. Like, we think about these things. It's because we're stretching the limitations of our mitochondria, essentially.
Yeah, it's fascinating what you just shared, and obviously mitochondria they play a big role also in many biohackers circles. People wanting to optimize their mitochondrial function. Then as a result of this, there's also many offerings. So many people now offer NAD plus IVs or whatever it may be. But you've talked about this NAD plus trap. So why boost or whether it's through NAD plus IVs or maybe even through the precursors NMN or NR, nicotinamide riboside, why that can backfire if you're fueling before you're cleaning. Can you maybe expand on that a little bit?
Sure. So for just a brief context, NAD is so popular because we know that the levels of NAD in our body decrease as we age. That's something we've seen. And so the logical conclusion is we must boost it, and then that will help our energy. And it is very involved. This is an oversimplification, but it's almost like having more gas in the tank. And so people have been supplementing it in various ways, and truly people do feel a bit better, like especially if you're getting NAD directly to the body, like through an injection or something like that. It's quite noticeable. But the problem is you're likely to overemphasize fueling, like you mentioned. And if you've got leaky holes in your gas tank, it's just going to be dripping out, overflowing, causing metabolic side products, essentially, some of which you may not want too much of. And so it's wasteful, and also you're missing the root cause of the problem, which is your broken engine. And so it's very important to actually take care of your engine. And actually, you might not need the NAD or the precursors at all. So that's something I encourage people to think about, is rather than Band-Aid solutions. And I totally get it. It's fine occasionally if you need something to boost your energy. We all use caffeine, I suspect, for example. It's not always bad, but what is the longer term sustainable solution is to take care of your engine.
And how exactly do we take care of the engine? So leaving aside maybe the more advanced things such as NAD plus or whatever it may be, that can backfire depending on which state the engine is in. How do we take care of it in the first place so that we may not even need these things at all?
Yeah. Well, I'm going to actually start with the less important things, because I know that's what people are thinking about, is supplementation. And there's like a lot of exciting stuff around the corner. I know SS31 was FDA approved for a very rare disease. And as a result, people are like, this is validating for mitochondrial use. These things are so minimally effective, especially if you are a generally healthy person, just trying to make sure that your mitochondria are up to speed, for example. There's a reason why we use it in these very ill people. It's because that's where you see the difference. But if you're walking around and doing just fine, unlikely it's going to make a huge difference for you. And there is evidence behind a few supplements. Obviously, people have probably heard of CoQ10, or urolithin A is another one. So CoQ10 is like an energizer for helping support the mitochondria. Urolithin A is something to clean up the mitochondria. And so they work in very different ways, so they can pair well together. They are effective, but they are nowhere near as effective as both fueling and working out your mitochondria. So I mentioned zone 2 and, zone 5 training, HIIT training. Exercise is the number one way to make sure that your mitochondria are doing well. It's way more effective than, red light therapy. There is obviously some evidence, and people probably have read this a lot, of all these products and interventions, but nothing beats exercise, which of course is sadly a bit more boring and hard to do thing.
Yeah, that makes a lot of sense, and I couldn't agree more with you. I think like a lot of people always want this magic pill which solves all of their problems, which is maybe a supplement or something like this. But this isn't like reality, as you mentioned. Like, people really need to do the work, zone 2, zone 5 training, all of this. But maybe let's get a little bit more specific here. For example, if you work with a high performer, which you already mentioned, who's doing the basics already, sleep, nutrition, exercise, all of this, but still is feeling off, like in that case, what are the most common underlying bottlenecks you see? Is it actually mitochondrial dysfunction? Is it maybe even HPA axis dysregulation, which you can also explain to our listeners as well, or chronic low-grade inflammation, something like this, or something else? Like,
yes,
what do you see?
This is a really good question, because I'll bet a lot of people listening are high performers. So lots of high performers, like people who lead companies, founders, creators, doctors, professionals, a lot of times it's not a lack of discipline, because they're probably trying to do all they can. It's a lack of recovery architecture. So what you can think about is you've optimized output. That's the exercising bit, but you also have to recover the recovery, or what I sometimes refer to as the parasympathetic floor. So, and for people who follow their HRV, by the way, the HRV, the reason why it goes down and down and down as you overexercise is because you're overemphasizing the output, the sympathetic, the energy in, and then you're de-emphasizing the recovery or the parasympathetic, to kind of oversimplify. And so we mentioned the HPA axis, the hypothalamic pituitary adrenal axis. This is often the bottleneck because people who are exercising or just trying a lot get stuck in this tired but wired state. So your cortisol is getting dysregulated. It's not like it's necessarily high all the time, because people ask me that. They're like, I tested my cortisol, it was fine. But it's more that it's high at the wrong times. Cortisol, for those who don't know, it changes throughout the entire day. And it might be perfectly fine or low at one time, but if it's high at a very strange time for your body, that also leads to that wired but tired effect. So it needs to go up and down according to a regular schedule, so that your body is up and going in the morning and then it calms down by the evening. And so when all of this is essentially getting mangled, your mitochondria and all your cells sense a threatened state. So it thinks it's in danger all the time. So they're essentially prioritizing your defense and not prioritizing future energy production. So even if you're doing all the right things, even eating perfectly, your cells basically are in this wartime mode, and they're not going to produce ATP or energy efficiently.
So you've kind of been touching on the kind of cell danger response, what many people say, which is also a part of, or many people in the root cause medicine field are kind of big believers, proponents of. The question I have is, how exactly do you do this step by step? So you have someone who is seemingly doing many things right, but they are still off. What's kind of the diagnostic way of figuring out what the actual problem is? Because of course, if you look at things very deeply, many things are connected. Now, how do you differentiate between everything is connected and that one thing is causing the issue?
Yeah. Sometimes it's very easy to recognize a bundle of like a syndrome, basically. So if I see somebody who's like very type A and they are the kind of person to do everything right, then it's almost always something wrong with the recovery and timing of recovery or getting enough recovery. On the other hand, if I'm seeing somebody who's I'm not, by the way, judging any type, but it's just, some people, they're coming to me and they're, struggling with weight loss that's piled on over the years. They don't have enough time to exercise, and they have kids, so they never sleep. So that's like another syndrome, like very clear to me what's going on there as well. So there's that pattern recognition that points me in the right direction. And usually that is very easily validated with, either blood work or with some of these wearables data. So that's actually that synthesis, or that is right now why a clinician's experience is so helpful. I mean, I think AI is going in that direction too. If AI had all the detection, like had eyes and could, interview the same way a human could, I have no doubt that it would also pick up on all these syndromes.
Interesting. Yeah, interesting. But so far, we still rely on that human touch to maybe detect the things that are kind of hidden between the lines of what someone is saying, right? Even if they don't mention it specifically, as a trained physician with many years of experience, you kind of see, okay, maybe there's something hidden there. And so that human touch is still very important, right? But maybe let's going more about into the kind of longevity interventions that are currently hyped. I mean, obviously, so many people are right now on their longevity optimization path, and everyone's selling something, right? So is it supplements, peptides, is it the GLP-1s, is it microdosing them, whatever it may be. From your clinical perspective, which of these things do consistently move the needle, and which ones are either mostly expensive placebos or even dangerous?
Well, I'll just get this out of the way, which may be one of those annoying, obvious things, which is behavior change is the absolute number one biggest lever. It's so incredibly obvious. People really don't like paying for it, in my experience. It's but a coach, getting literally just an accountability coach, even if you know exactly what to do, is possibly the biggest lever anyone can make. And it's so boring. So no one likes, advertising it. And coaching businesses, as far as I can tell, aren't exactly runaway successes for this reason. But it is definitely true. I think I was writing because I saw some research about, the market trends. Things are going more towards movement and exercise, and also recovery, by the way, and less focused on food. And it's a result probably of the GLP-1 revolution. People are eating a bit less, and so there's less there. But something interesting I saw is actually the supplement industry is also not doing quite as well as the movement and recovery side of things. And I was like, that's interesting and kind of cool, because I think it's moving according to science is how I see it. We know that movement, recovery, sleep, these are the important biggest levers. And for nutrition, not that nutrition isn't important, but the most important part of nutrition to fix for most people is to decrease calories. And if you do that, and you maintain like an adequate, important macros, things like protein. I'm very big proponent of a protein first approach. Then you're probably set. You don't need to overthink a lot of the other things that I think traditionally or in the past, we've been so caught up about so many little details about nutrition, and there's still ongoing social media wars about it. So that's what's true. And then kind of along those threads, if we're talking about medications and supplements, there's no doubt that GLP-1s have been the darling and very deservingly so of the entire field of not just longevity, but healthcare in general. It's made more of a difference than any other medication I've seen ever. And I think it has far-reaching benefits that we don't still fully understand. So.
Yeah, I mean, I personally couldn't agree more. And this is also a topic I talk about all of the time, not GLP-1 specifically, but like that people need to do like exercise, sleeping well, recovery, all of this. And as I said, again, like most people just don't want to do this. And this is maybe also why GLP-1s work so well, because it just
works
solves
on the brain.
this.
Yeah,
pretty much. It just solves this problem of eating too many calories. But let's step this aside for a bit now. Gal also mentioned peptides, and I saw that you wrote a piece about peptides as well. And for example, in Germany, peptides aren't even legal. Like, I don't know if you knew this, but you cannot get any peptides legally in Germany, for example. So I want to talk about this a little bit. Like you also mentioned the dangers and the risks, especially by delivery routes, injectables, nasal, sublingual, all of this. What misconceptions do you see right now when people are self-experimenting all of the time with, like, especially research chemicals, pretty much?
Yeah. Well, GLP-1s are peptides, and that's a big reason why everyone's so excited, because we saw, wow, these peptides are the most powerful things we've ever seen. So what are other peptides that we could possibly get? And unfortunately, most of the ones that are currently out there right now, I would say it's a lot more hype than benefit. Like if you even like, and I spend some time on Reddit because I'm just so curious about what the underground is thinking and doing. And the Reddit folks, the Reddit biohackers, even if you look very, very clearly through what they see as effective, it's mostly GLP-1s. Like they're just talking about GLP-1s. They're talking about the new GLP-1 retatrutide a lot. And that, by the way, is going to be such a game changer, even in addition to what we already have. And the other ones, yes, they're supportive, but I think there's not nearly as much substance to some of these gray market peptides as people believe. And a lot of the ones that already work are the already FDA approved ones, like the GHRH growth hormone type peptides. And still, those are still supportive in addition to the GLP-1s. There's like a alphabet book dictionary worth of peptides out there, so I'm not going to cover all of them. But I will say most of them are basically placebo for most people. That's not to say that peptides as a class are effective or not. I just think it's like a misunderstanding. Some peptides are going to be very powerful and some of them are just not that useful. But also I wanted to talk about, since so many people are going to the gray market, and some people don't even realize they're going to the gray market when they buy these things because it's so easily accessible online. So if something is labeled research use only or not for human consumption, that is what we're talking about with this gray market substance. It's different from compounding pharmacies, I want to mention, because compounding pharmacies are actually FDA regulated places where they get audits all the time and making sure that they're sticking to good manufacturing practices and so forth. So compounding pharmacies are different from these direct from overseas type places that people are ordering peptides online from. And the danger is when people, I hear a lot about like sovereign medicine. People are like, okay, we're just going to order the ingredients online. We will get somebody else to test it, and then it'll be safe to inject ourselves. And the reality is most people have been fine. We haven't seen a lot of, emergencies or really, really horrible short-term effects. We'll see about the long term. But I think people should still be aware that something could happen. So even if you get from a third-party tester saying something like, this is 99% pure, like whatever it is that you were trying to order, pure ipamorelin or something, then that doesn't mean it's necessarily safe because they haven't checked yet for toxins like endotoxins or, whether there's some add-ins that might be harmful, even though it's a small amount. And also what happened during the chain of custody. So was it shipped in a way that was like made the peptide no longer useful? Maybe it wasn't completely refrigerated the entire way, or maybe there's something even wrong. So people, a lot of times they're mixing powders with bacteriostatic water themselves, and maybe there's something wrong with the water. So there's like a lot of things that could happen when the end consumer becomes essentially the doctor and the pharmacist as well as the consumer. Oh.
Yeah, that's a fair point. And thanks for shining light on this topic and on the issues just around this misconception about like people injecting a whole lot of different stuff into themselves, which isn't like really tested even in some cases. So that's really good that we talked about this. Now I want to dive a little bit deeper into the healthcare system as a whole, or maybe even the healthcare system as a continuous system going forward, which you've talked about as well, like this shift from episodic care to like really continuous longitudinal care over years. So like in your experience, like what does that actually look like structurally when done well?
I think this is the big unlock to healthcare and medicine of the future. Because right now, we don't have enough data to make proper conclusions or to figure out what a root cause of anything is. And it also is very restrictive for the types of tests. So let me use cancer medicine. So I come from a background of oncology, and the big problem with all of these blood biopsies sort of screening tests for cancer is you don't know sometimes, like, oh, you get a positive test. What does that mean? So the tests right now that are FDA or not even FDA approved, but that are being used commercially, they tend to be much more conservative. They're not going to say you are positive unless they're very sure, because it'll freak people out. But if you imagine that you had a continuous, let's just say saliva test for any signs of cancer in your body, and you take that every single day, then you can follow the trend line that's like, okay, it caught something that looks like a breast cancer, but it's so small. Let's watch it over 3 weeks. If that goes up and up and up, then we know something is happening that's real. If it's just up and down, it's possible that, your immune system took care of it and now it's gone. And so that's just one small example, but you can think of that for literally any disease or prevention of disease in the future as well. We just need more ways to collect and analyze real-time data. And this is the entire thesis behind the omics revolution. So proteomics, lipidomics, metabolomics, these are byproducts that we can detect, but right now are super noisy. As you can imagine, we've got like billions of data points that we don't know what to do with right now, because people are trying to give them as point in time sort of tests. Like, okay, if I take a test today, then it looks like this. This is also the problem with mitochondrial tests. So sometimes people ask me about mitochondrial testing, and I'm like, It's so cool. I wish we had a good option for people trying to optimize their health. But realistically, your mitochondria is going to test differently based on, for example, where the sample's coming from, but also the time of day, like whatever happened yesterday versus today. And so it's very sensitive to fluctuations, basically. And if only we had a more continuous method of measurement for all of these things, then we could actually use this really, really interesting data.
It's so cool, all of the things that are currently on the horizon that people are already working on that may not be yet to the standard of really making clinical decisions, but may be so in the future. And I guess this is also what people are kind of demanding from the bottom up, having more authority over their own health trajectories and being more informed and more involved. And that's kind of a very big change compared to how healthcare has traditionally been in terms of the doctor-patient relationship that has been very one-directional and where not both parties were like equally had equal access to information. With that changing, kind of coming from the bottom up and people demanding things, where do you think are kind of right now the biggest bottlenecks in terms of changing this healthcare model where people want this ongoing optimization of their mitochondria or whatever that may be, rather than acute problem solving? Is it the reimbursement? Is it the liability? Or is it also maybe things such as provider training and involvement?
Yes, this is, I, as one human, will not solve this today, but I have some theories that I actually think, interestingly, this is where keeping things in health optimization / wellness might actually be more fruitful than trying to bring it into the healthcare system. And the reason I say that is because the healthcare system is more regulated. And so you're not going to be able to move as fast. And fairly, all of these measurements we're talking about are more for function and for performance, right? So it's not like, I mean, some of the things we mentioned could be tied to disease, and they very clearly are, but it's mainly for optimization of health. So I think staying in this realm is probably actually the near-term solution for the entire industry to innovate faster. And eventually maybe the entire industry of healthcare will change and then we'll reimburse differently and we'll get there. But that's what I think right now is unfortunately the result. And I think for what it's worth, like in the past, people were not as willing to spend out of pocket dollars for their health, but we're starting to see, like, at the end of the day, it's the only thing that matters. It's like we buy clothes, we buy cars, but like if you spent just that bucket of money towards your health improvement, it changes your life entirely. And people are starting to recognize that a lot more. And so they're changing their budget allocation towards more health optimization and performance.
Yeah, that's so true. I mean, we really see these kind of new trends and people now getting out of it at 6 a.m., going to a run club rather than getting back to their homes at 6 a.m. from the nightclub. So
I've saved so much money since I stopped drinking alcohol.
I mean, there's certainly this cultural shift, and it's undeniable. And I think it's definitely a good thing, 100%. But also, interestingly, because of these new, let's call it movements, there has been an interesting overlap of certain definitions, right? So where do we draw the line between what's prevention, what's optimization, what's longevity medicine? Maybe these things, they do overlap quite a bit. And also with regards to the people who are actually leading this change. It used to be doctors. Now it's probably the doctors that have turned into creators that are sharing messages and that become a voice, thought leaders in a space where many people want to listen. And so that's also very interesting, this kind of rise of social media creators and people having a more decentralized access to information. And kind of CareCore sits exactly that, right? It enables wellness creators and brands to offer like doctor supervised programs. Now, a little bit of a skeptical question. Where's the line between democratizing this access and diluting this medical responsibility?
I think the way we are handling it is that we are separating, it's like church and state. We are separating the medical oversight from the creator / educator. And I agree with you that every single clinician or health coach, say you're not like strictly a licensed clinician, the move right now in the age of AI and automation is to level up, to become a chief medical officer instead, is sometimes how I describe it. You basically want to be the person projecting a message about health to your audience, and you are instead getting help from automation, or, in our case, it's not automation quite yet, but it is a huge team of clinicians working towards, medical oversight for you. And so that, I think, is that separation that's currently still needed. I think the guardrails are going to change. Like we were talking early in the interview, like today it's using human clinicians to be that guardrail. It will steadily be more and more automated as AI becomes more proven and validated, however. And at the end of the day, we're seeing that AI first clinical decision making is a lot of times matching or superior to a lot of what traditional clinicians can do. And it's starting in the more simple, like health optimization, wellness fields. It's less risky, but it's going to move more and more into the meatier type topics and medicine for sure.
Yeah, definitely. I have one more question, which is also maybe a bit skeptical.
Sure.
But like, I'm really interested in whether, or what your opinion as an expert also of founding Careco, and you and creator yourself on LinkedIn, Instagram, and also doing podcasts, for example, this one here. But like, it's super hard for me to think about this. Like, how do you maintain clinical rigor, for example, when the business model or the algorithm of Instagram, for example, rewards volume and engagement and all of this rather than like scientific accuracy? For example, if I say BPC 157 will solve all of your inflammation problems in your whole body, yeah, then you have like 1 million views. And if you say, BPC 571, the scientific evidence isn't quite there yet, and let's see, maybe in 10 years, I don't know, 0 views. So like pretty much, how do you solve this, or how do you stay yourself, maybe even?
Yeah. I think this is a very tough balance, and it's individual for every creator. For myself, I feel lucky that creator is not my full title. It's not my source of income almost at all, actually. I don't really use it in that way. It's just my loudspeaker. And I think that's important, because when you get tied up to monetization partnerships that may not go along with, what you feel is morally right, then that pulls you in a direction that you wouldn't want to be. So I think if it's possible, it's important to maintain a portfolio of activities and roles in life. And you're not just making Instagram reels. You are also, an educator in a university, or you are a scientist, or you're a founder, or whatever it may be. I think that's important to have substance behind your content. But also, I think it's the long term rewards people who have more substance and science behind what they're saying. So yes, the short-term clicks and grabs are, something very miraculous sounding, or, provocative, but that's short-term attention. And also the people who are going to follow you in those cases are probably actually not great audience, like people to have, because they're just looking for entertainment more than they are looking for true solutions in a lot of cases. So I think the TLDR there is, if you are a clinical creator, a medical or provider who's creating content, focus on the long game rather than the short game. You do have to have a little bit of pizzazz and entertainment for anyone to watch you at all, of course. Yeah. But yeah, it's a long-term game that you're playing.
Yeah, love it. I 100% agree. I think in the long run, if you do good content, you will eventually, eventually land to like some good results, pretty much. So, always play the long run. I totally agree. One topic which is also in hype right now, probably also maybe because of Brian Johnson, for example, or other biohacking influencers, let's say, is biological age testing. And I heard you wrote somewhere that you predicted that biological age testing may become as routine as checking cholesterol, for example. And so I'm really wondering, like, which biological age test and all of this do you think will actually gain like clinical traction versus like remaining in boutique longevity metrics, which like some wellness influencers or biohacking influencers are just pushing.
Yeah, no, there's like a million biological tests out there.
Yeah.
And I think some of them are gonna rise to the top. Some of them are more backed by a lot of research, and I'm interested in them. Like different pace of aging type tests, they're very interesting, but they still work based on machine learning correlations. There's another concept here called the intrinsic capacity, which some people might have heard of if they're following ARPA-H or similar work. And we're trying right now to find out what number can be used for intrinsic capacity, which is essentially kind of like a health score or biological age. And I suspect that's going to come out of a combination of biomarkers plus functional tests, even things like grip strength, for example. So it'll be a lot more complicated than probably just a simple, finger prick test. But I'm optimistic about the future. Right now, it's still in the realm of the experimenter. So I do use biological tests, but I always tell everybody who I'm ordering it for, I'm like, this is not the end all be all. It's still very experimental.
Interesting. Yeah, I mean, these are still the things that make the headlines, right? These are the things that people want to hear, that are interesting, that like, oh, my biological age is 20 years younger. Even if that may not, as of now, be enough for really making clinical decision making. But yeah, this is kind of the things that makes the headlines. And maybe you can think of other things that may make the headlines already, trends in longevity that look scientifically very promising, but are maybe just structurally unscalable, meaning it won't move beyond the 1%, even if the data holds up.
Yeah. I think there's a big one that comes to mind immediately, which is TPE or plasmapheresis, total plasma exchange. It's very interesting. I think there's a lot to, quote unquote, cleaning out your blood, putting in, some factors from younger people's blood. It's very promising. That being said, the infrastructure for that is so involved. Like you need to have staff, you need to train them, and it's this hours long process. It's not practical and at the large scale capacity perspective. But I'm still excited about the general concept, and I think there's learnings we can take away from it. And I don't doubt that in the next 5 to 10 years, we'll find a substitute for that works better, that's more scalable.
Yeah, I find it so interesting because I have already done 2 ionospheresis, not TPE, not total plasma exchange, but ionospheresis, where they use like special filters and then they kind of re-administer your clean plasma back again. And I do find it very, very interesting. But again, just thinking about it, it's such a complex procedure, takes such a long time. There's risks involved. There always needs to be someone in case there happens an emergency and so on and so forth. So likely the cost of it will come down, but not so significantly as that really a vast majority of people can have access to it. So yeah, I think it's also really interesting. Now, moving on to the second to last section, we do have a little bit of social media rapid fire question style. So for the next few questions, please keep your answer brief, meaning 30 seconds or less. And we'll just start. I'll shoot the first one. So one longevity intervention that looks boring but delivers outsized returns.
Zone 2 cardio. Very boring, takes time, but it really builds your mitochondrial engine.
Yeah. What is one popular longevity trend people should be more skeptical about right now?
IV drips for hydration. It's just expensive urine unless you're clinically dehydrated.
One biomarker or signal you think will matter much more in 5 years than it does today.
HRV. It's already important, but it's a great example of a continuous biomarker.
Amazing. What is one constraint like on health span most people still underestimate?
Loneliness. This is so harmful, and it changes us on a gene level.
Interesting. One thing you changed your mind about in medicine over the last decade.
Nutrition. Huge topic, but I've gone from the caloric restriction fasting realm to a more high protein precision nutrition perspective.
Amazing. If you could only fix like one structural bottleneck in how longevity medicine gets delivered right now, what would it be?
State by state licensing. Sounds strange, but it is a very big bottleneck in true digital health scaling.
Very interesting. Okay, now moving on to the final question, the return on health question that every of our podcast guests gets to answer. It's the following. If you could change one thing in the current healthcare system, does not need to be longevity specific, can be the whole system, what would it be?
I would switch the entire system from snapshot medicine to continuous data lake monitoring. So we were talking about, we practice medicine based on single data point collection, maybe once or twice a year. It's like predicting the stock market by looking at information about a company on a random Tuesday. So we need to, and it really
Very
is.
good example. Wow.
Yeah. So if we move to continuous monitoring from wearables to labs to lifestyle data fed into a data lake and monitored preferably by an AI with automation, we wouldn't just treat heart attacks at the, when you're already very sick, but we'd be able to predict them. We'd be able to catch signal drifting before the crash. And so that's the only real way that we move from that reactive sick care system we live in right now to proactive healthcare.
Dr. Hilary Lin, thank you for bringing systems thinking and clinical restraint into a space that often rewards speed over responsibility. So thank you so much for sharing your perspectives.
Thank you so much for having me.
Yeah. Thanks a lot also from my side. We'll link all of your companies, CareCo. We'll link your newsletter as well in the show notes and also all of your socials. So every listener can check you out after the episode.
Also,
thank you so much.
To the listeners, if this conversation shifted how you think about optimization versus infrastructure, send it to someone who needs to hear it.
Thanks for listening. We'll see you next time.
Right.